Just last night, I was outside the studio. Two young fellas, mid-20s, came up to speak to me. They were both in their 7th year, getting fully trained as doctors, and one of them said to me, "I'm off." I said, "What do you mean you're off?" "I'm off to go and work in Germany. The money's better, the conditions are better." The other fella said, "No, I will be staying as a doctor in the UK, but I'm just worried that taxes keep going up and up and up." Well, a survey that's been done, quite a big survey, suggesting that a third of people who qualify, they've gone through the whole process of being medical students, a third of them who qualify disappear. They go. They're going off to New Zealand. They're going off to Australia. They're going off to America. They're going off all over the world. They're getting a load more money, and somehow I just do not think this is right. Well, Kent GP, Dr. Julian Spinks, who's been on this programme before, joins us. Julian, we've invested a lot of time and money in these people. 7 years. I mean, goodness knows what the public cost of every qualified GP is. And they're free to just disappear. Hasn't something got to change here?
I think there has to be, and have to say that the investment they've made as well is enormous. And they're looking at the situation where, for example, the starting doctors' wages now are below people who they're supervising, and it takes about 11 years to actually get their total earnings to match things like physicians' associates who have to be supervised by them. They are working in a system which is falling apart, hospitals that are deteriorating with dodgy concrete.
So morale is bad.
It's really bad morale. So it's not just income, it's the quality of life, the fact they can earn more money, do less hours of work, be appreciated more, and maybe have a nice beach down the road. I'm not surprised they're talking about doing it. And the same thing's happening at the other end of the spectrum. The people of my age who are getting towards the end of their career, they've suddenly realised that they've maxed out their pension, they can't earn any more.
Yes.
And they say, well, why do I stay here? I can go and get more money and have a better lifestyle over there for a few years.
So we have a massive problem. And, of course, like so many other sectors of British life, we finish up with a shortage of trained people for a variety of reasons, and we rely on immigration to plug the gaps.
That's what's so crazy. We're training people to man the Australian, New Zealand or whatever health service, and then we're bringing people in, often from countries who desperately need those doctors.
West Africa or whatever it may be.
Absolutely. So we've got to find a way to keep them.
You see, to me, I mean, look, it's a long apprenticeship, but ultimately, when you get there, you can earn a very good living. You can do private consulting on the side. It may be a long apprenticeship, but there is a big prize, economic prize, ultimately, for those that qualify and move on. You see, I think there was this old Victorian concept, sort of Dickensian concept of indenture, that you had to sort of work your indentured period. And I think if we've invested 7 years of our expertise, our time and our money in training these people, don't they owe it to us to give us at least a few years of service before going abroad?
I think what they'd say is that they have student loans often well over £100,000. And so I think we've got to look at carrots rather than sticks. But the carrots could actually result in a degree of service. And the thing I look at is, the army will pay you a bursary to train as a doctor, providing you work a certain number of years, or you have to pay back the bursary. But, why not look at all those student fees they're paying, the student loan, and write off some of that in return for doing a certain number of years' service in the NHS? That actually doesn't front-load the cost, because for the government, they don't want to spend lots of money right now, but because people pay student loans back over a number of years, it spreads the cost for the government, and it means that there is a financial incentive for people to stay on. Not right now, because obviously, if you start as a GP, you're well below as a doctor, you're well below the amount that would mean you pay back your student loan. But it's a way of trying to encourage people to stay on, whereas if they leave the country, then unfortunately they get the full fees again.
Yeah, and they're running up, as you say, big debts. The interest rate on those loans is about 7.5% now, I think.
It's a crazy amount.
Or something like that.
My children who are not doctors, some of their loans are 3 times what they took out, simply because it's going up faster than they can pay it off.
More broadly, Julian, I have to just, whilst you're here, look at the amount of money we're pumping into the NHS. We're spending about 50% more of our GDP on health than we were less than a decade ago, and no one's seeing any improvement. What on earth are we going to do?
It's a very difficult thing to deal with because actually the health service was neglected for a time. We've ended up with a situation, it's rather like someone who's not bothered servicing their car. And they've said that because they've got to use all the money they have for the petrol they need from a day-to-day basis. And 5 years on, their car's falling apart, it's breaking down and so on. And that's what's happened to the NHS. And it's far more expensive now to fix it than it would have been putting some investment in earlier. But it is very...
But we are where we are.
We are where we are, and we've got to do something to actually tackle that. I mean, we've got, unfortunately, things like dodgy concrete means that money's going to go to that rather than actually building better hospitals. As a GP, I'm aware of the fact that we struggle to have actually enough consulting rooms. People want to see GPs, want to see other people. We haven't got the room to put them in there. So, you know, there is a big challenge. But it does need a degree of looking at how we organise things again. And I think it can be fixed, but it's not going to happen in the next 2 years.
You've been a GP for a long time. How many years?
Well, in the days when we were, using quill pens, about 35 years. 35 years.
I will bet that when you started, public trust in the National Health Service was incredibly high.
Absolutely. Absolutely.
How far has it fallen?
Well, I've spent sort of about 32 of those years absolutely defending the NHS and defending general practice. When people said, I can't see my GP, I'd say, hang on a minute, have a look at it. Now it's getting more difficult to defend it. We are still working our cotton socks off to try and make sure we can see people, but at the same time, we can't actually meet demand. And I can't say to people, you'll always be able to see a GP, you'll always get a consultation in a very short order. It's just not there anymore, and it's not for want of trying or a desire to actually do that and provide that service.
Now, Julian, we were talking about junior doctors. You're a more senior doctor. You could go to Australia. And it's interesting. Of those medical students that want to go, 40% of those that want to leave the country want to go to Australia. You could double your money and go to Australia and live in the sunshine. Is it tempting?
I could, and I have had targeted ads saying, why not come to Queensland? Why not do that and so on. I have to say that I am very happy as a UK GP, despite all the problems. I really like working there, and it's always been a thing for me about paying back to people and actually helping people. It's the thing that gives me the buzz rather than just the financial side.
I believe you. Julian Spinks, thank you for joining us again.